Unconventional approach to conventional challenges. A very unique topic for discussion in the times that we are right now in. So, we have seen numerous videos, photos, posts on social media by the doctors worldwide. One such post that I saw, which caught my attention, was "You stay home for us, and we will fight for you." As doctors have families too. So, Dr. Leena Pradhan-Nabzdyk is the assistant professor of surgery at Harvard Medical School and is also wife of Dr. Christoph Nabzdyk. So, Leena, balancing a role of a wife and a mother on one hand and a dedicated healthcare professional on the other, can you please share how life has been for you since this has all started personally and professionally?
Sure. I just want to say thank you, Priya, for inviting me, inviting Christoph to this panel. And it was really nice hearing everybody's perspective. Thank you for sharing your perspective. Yes, so as you mentioned, I'm a scientist myself and and somebody who's working in a healthcare system and who has a spouse in the healthcare system. So it has been quite challenging for us in the sense that I'm dealing with challenges at my work and the people I work with, what they have to go through, but also looking at our home front. And I think I'll speak more from the perspective of, from being a spouse of a healthcare worker. So when this started coming up, the stories about SARS-CoV-2 and COVID, and when we started looking in the media, and this was probably in January or February, Christoph and I, we were like, starting to look more into it because we had actually planned a trip to India to visit my elderly parents towards the end of March. And in fact, Christoph was in India for a conference end of February. And, we were already thinking maybe should he cancel the trip? What should we do? We have a 6-year-old. I also have an older child. She's independent. She's working in Boston. And so as a family, we had to, as healthcare workers, we really had to get on on planning our lives. And so the first thing we had to do was make sure that, my parents who are in India, they're elderly. And if they were okay, my brother lives in Bangalore. My parents live near Thane in Maharashtra state. So that was the first thing. But then, we had to talk about our own lives with Christoph being an ICU doctor. And as more and more news started coming out about, what is happening and how much care these patients need, and almost a lot of them end up in the ICU, and the transmission of the virus and how it is affecting the frontline workers, we really had to sit down and make a plan for our family as to, how do we protect our unit? So we are 2 of us living in a house with our 6-year-old. And this is a story for pretty much every healthcare family as to how do you deal with somebody who is going out in the field, is treating some of the sickest patients or dealing with some of the sickest patients, and then how do you protect the family when you come home? So our plan was to, if this gets really bad, Christoph was just going to move out. And in fact, I do have friends who have moved out, or the healthcare provider has moved out of the family, and they have to think about taking care of, how do you, if you have a 6-year-old in the house, and if you have a parent who can't see them, I mean, even littlest things, you have to plan about those things. And with schools out, how do you manage that? And then on top of it, I have 2 jobs. As I mentioned, I'm a scientist, and I'm also an entrepreneur myself. I have a life sciences company. So it has been very challenging for us to take care of our son, my husband being at work most of the time. I'm working from home. But one of the things what Aju was talking about is how do you keep the morale up, right? Not only for your co-workers, but also for your family. So one of the things that we started doing more often, especially at work, is getting together on remotely on any of these platforms, video conferencing platforms, and just sharing, talking about things, talking about families. Normally, when we work together in person, we're just always rushing, doing 5 million things. So that has definitely helped. also in, talking from a family perspective, now we have, weekly Zoom meetings with our extended family, with everywhere, family being, in Europe, in the US, in India. So that has also helped. In fact, my son all of a sudden realizes that he has like 15 cousins that he's never really met in person. So there are opportunities, and there's hope. One of the other things that I would like to stress on is to take care of not only your immediate family or people in your immediate circle, but also your neighbors. So early on, we had some scare about some exposure, and so we were essentially quarantined, and a lot of our neighbors helped us. They were bringing us food, they were making sure that we are okay. And so I think one thing that we absolutely have to keep this in mind, and I think Frank stressed on it, we are all in it together. And this is something that has affected everyone globally, and pretty much in a very stressful way. And as long as we look out for each other, I think we will be good, and we will come out on the other end as a better unit, a single unit that lives on this planet. So
my next question is going to be a question that is basically your personal reflection. What was your most impactful personal learning during this pandemic, and what is your advice to the viewers?
Sure. So one thing I can definitely say, from the scientific community, we are working very hard to come up with new therapies, new treatments. So there is a lot of hope. In fact, my lab itself is also working on a lot of COVID-related research. But so there is a lot of hope. I know there are scientists all around the world working very hard. There will be breakthroughs coming through very soon. There will be treatments, there will be vaccines. So that is on the healthcare science side. But from a personal side, just like everybody said before, forming relationships, renewing your relationships, not just with people, but also with Mother Nature. So I'm getting my son into gardening, and getting our son into bird watching, and just connecting with Mother Nature, connecting with family. And as Christoph said, this was the first time in our us being together that we could spend some quality time, reflection and quality time together as a unit.